Well, leaders in the medical sector are pressuring the government to commit to more health funding to fix systemic problems with hospitals and also general practice. Joining us now live is the Australian Medical Association President, Dr. Steve Robson. Steve, good to see you as always. Thanks for making the time for us. You want this to be a health budget. Where should the government be starting on this front? What are the big things that you'll be looking out for tonight?
Yeah, good afternoon. I think Australians around the country think the same way that the Health Minister does, that the crisis in general practice is making everything else worse. And Australians who need to see a GP find it's increasingly difficult to get an appointment. They're finding affordable care more and more difficult to access. And it's a major problem for Australians who are vulnerable, Australians with health conditions. And it's having a huge effect on states and territories, because if people can't get care with the GP, they're having to go through public hospitals, which is making the logjam in public hospitals worse. So we're looking tonight for a big investment in general practice. We need to make sure that all the most vulnerable Australians have access to a GP, affordable access, and that's really the key ask we have from the government tonight.
We have already seen the announcement around GP funding grants. How far will that actually go in terms of helping to ease the crisis that we're seeing in general practice?
Look, I think the issue is that we've seen such a real terms fall in funding for so many years that it's making a lot of general practices borderline viable at the moment, and we know that affordable care is more and more difficult. So I think we're going to have to see a very big investment this evening. I've spoken to the Minister. We've advocated very strongly about investing in general practice, making more appointments available out of hours, looking at reforms, for example, in telehealth for people who need it. And also, I guess, building resources for Australians who need complex care and people, for example, with conditions like diabetes and complex mental health problems. We want to see funding models that make the kind of care that they need to keep them out of our public hospitals and keep them healthy really up tonight. So we're looking for a big investment from the government, and that's what we hope we'll get tonight.
The government has confirmed that we will be seeing a surplus. The government will get the budget back into black for the first time in 15 years. Should we be having a surplus, do you think, at this point when, as you've just been outlining, there are so many pressures on the health system that could certainly use with a funding injection?
Look, I think our primary concern is making sure the population is as healthy as possible. We know there's an enormous workforce shortage in the country, and that's a huge economic break. It's like a lead weight around the economy at the moment. So having Australians as healthy as possible, and that means everything from great control of chronic disease to having the hundreds of thousands of Australians who are on waiting lists to have operations really sorted out, funded and resourced. And the more people we can have living their lives and being as productive as possible really is a big boost to the economy. So we think it will have an economic payoff if we invest in health, and that's what we're certainly wanting to see.
Steve, I see that in the AMA's pre-budget submission, you again put forward this idea of implementing a tax on sugary drinks. This isn't a new idea. I know the AMA has been pushing for this for I think many years now. Are you getting anywhere on that? Each year that you bring it up, it seems to be ignored by successive governments. Why is that?
Yeah, look, we know evidence from around the world. There are something like 82 jurisdictions around the world who've instituted a tax on sugary drinks, and it certainly seems to be bringing health benefits. Last year, the World Health Organization came out as an international goal that this has done. We think if we look at the number of people with obesity, with diabetes, and all of the things that flow from a big intake of sugar, that a simple price signal on sugary drinks is likely to have beneficial flow on to the health system, and it also brings in money for the government. We think it could bring in potentially billions of dollars at a time where the government really is looking to fund programs like this. And we think because most Australian sugar is exported, it really shouldn't have a major effect on sugar growers around the country. We think it's a win-win for everybody, and we'd love to see it brought in. We'll be seeing if anything like that comes up in the budget tonight.
Yep, there's always a few surprises. We'll have to wait and see. Just a few hours to go now. Dr. Steve Robson from the AMA, appreciate your time. Thank you.
It's a pleasure. Thank you.